7 early symptoms of a heart attack and how to prevent a heart attack. Imagine that, without warning, your heart, the organ that keeps you alive, starts to fail. You might feel a crushing pressure in your chest, a pain that spreads through your body, and terrifying shortness of breath. This is not a nightmare. It is the reality of a heart attack. Worldwide, heart attacks are the leading killer, claiming around 400,000 lives per year, according to the Cardiology Society. Every minute counts. Identifying the signs of a heart attack and seeking immediate medical help can be the difference between life and death, between full recovery and devastating sequelae. Being aware of the early symptoms of a heart attack is not just important, it is vital. Let's explore the warning signs you cannot ignore, the types of heart attacks, their causes, and the worrying increase in cases among young people under 40. Share this knowledge with everyone around you. Remember, only 5% of the Brazilian population knows how to recognize the early symptoms of a heart attack. Imagine how many lives can be saved with this information. Pay attention, your heart depends on it. What is a heart attack or acute myocardial infarction, AMI? A heart attack or acute myocardial infarction, AMI, occurs when there is a blockage in the blood flow in one of the coronary arteries, which are responsible for supplying the heart muscle with oxygen and nutrients. This blockage is usually caused by atherosclerosis, a condition where fatty plaques build up in the arteries over the years. Factors such as stress, vigorous exercise, fright, or lack of sleep can trigger the rupture of these plaques, leading to the formation of a blood clot that partially or completely blocks the artery. How does a heart attack happen? When the fatty plaque ruptures, platelets try to seal the rupture, resulting in the formation of a clot that blocks blood flow in the coronary artery. Other less common causes include vasospasm, which can be triggered by drugs, stress, or cold, and coronary artery dissection, where the inner wall of the artery tears. The obstruction of any coronary artery causes ischemia of the heart muscle, leading to tissue death due to lack of oxygen and nutrients. Symptoms of a heart attack. 1. Chest discomfort. Most heart attacks start with pain or discomfort in the center of the chest that lasts more than a few minutes. This pain can be described as uncomfortable pressure, heaviness, tightness, fullness, or burning. It is important to note that this pain can come and go, making it difficult to discern the severity of the situation. If the pain persists for more than 5 minutes, seek help immediately. Ignoring this sign can be fatal. 2. Discomfort in other areas of the body. Besides the chest, discomfort can spread to other areas of the upper body. This includes the arms, hands, back, neck, jaw, or stomach. The pain may be felt in one or both arms and may be accompanied by numbness in the hands. This widespread discomfort often confuses patients who do not associate these symptoms with a heart problem. Be alert and do not underestimate these signs. 3. Shortness of breath. Shortness of breath can occur with or without chest discomfort. When the heart is not pumping blood effectively, you may feel difficulty breathing. This symptom can appear suddenly and be quite frightening. The sensation of suffocation or the inability to breathe deeply should be a warning sign. Do not wait for shortness of breath to pass on its own. Seek immediate medical attention. 4. Cold, sweat, and pallor. During a heart attack, you may start to sweat cold and feel your skin pale and clammy. This sweat is different from exercise-induced sweat, being colder and stickier. The skin may appear pale or grayish, reflecting a lack of proper circulation. This is a serious symptom that often accompanies other signs of a heart attack. If you or someone around you experiences these symptoms, seek emergency help. 5. Nausea and vomiting feeling. Nauseous or vomiting can also be a symptom of a heart attack. This occurs due to the reaction of the vagus nerve, which can affect the stomach and digestive tract. These symptoms are often mistaken for gastrointestinal problems, delaying the search for medical help. In the context of other heart attack signs, do not ignore nausea and vomiting. 6. Dizziness. Dizziness is common during a heart attack, especially among women. You may feel like you're going to faint if you try to stand up or exert yourself a bit more. This sensation of vertigo can be accompanied by a general feeling of weakness. If you feel dizzy along with other heart symptoms, consider this a warning sign. Seek medical assistance immediately. 7. Anxiety. Feeling a sense of impending doom or having a panic attack without an apparent reason can be a sign of a heart attack. This feeling of anxiety can be intense and unjustified, causing inexplicable agitation. Often this anxiety is an early sign that something is wrong with the heart. Pay attention to these feelings and do not dismiss them as mere nervousness. Seek medical help if anxiety is accompanied by other heart attack symptoms. Differences in symptoms. Between men and women, chest pain is the main symptom for both men and women, but women tend to describe the pain as tightness or pressure, while men describe it as heaviness. Additionally, women are more likely to experience shortness of breath, nausea, vomiting, and pain in the back or jaw. Fatigue is a common symptom in women, which can lead to confusion with flu or COVID-19 symptoms. There are two main types of heart attacks. 1. ST elevation myocardial infarction, STEMI. The clot completely blocks the blood flow in the artery, and this blockage is visible on an ECG. This type of heart attack requires quick action due to its severity. 2. Non-ST elevation myocardial infarction, NSTEMI. The artery blockage is partial, and although the ECG may not clearly show the heart attack, the heart muscle still suffers, as indicated by elevated cardiac enzymes such as troponin in the blood test. Risk factors for a heart attack. Here are the points with information based on science and medicine. Age: men over 45 and women over 55 are more likely to develop heart disease. This is due to factors like the decrease in estrogen levels in postmenopausal women and the gradual increase of risk factors with aging. Studies show that cardiovascular risk progressively increases with age, regardless of other risk factors. Smoking. Smoking, including secondhand smoke, is strongly associated with cardiovascular diseases. Nicotine and other chemicals in cigarettes damage blood vessels, raise blood pressure, and reduce the blood's ability to carry oxygen. Smoking also promotes plaque formation in the arteries, increasing the risk of atherosclerosis and heart attacks. 2. High blood pressure. Hypertension damages arteries over time, making them less elastic and more likely to narrow or rupture. This can lead to cardiovascular diseases such as heart attacks and strokes. Controlling blood pressure is crucial to prevent these complications, requiring monitoring and often medication. High cholesterol. High levels of LDL, bad. Cholesterol and low levels of HDL, good. Cholesterol significantly increase the risk of heart disease. LDL cholesterol contributes to plaque formation in the arteries, while HDL helps remove cholesterol from the arteries. Maintaining healthy cholesterol levels is essential for preventing cardiovascular diseases. 2. Obesity. Obesity is related to elevated levels of cholesterol and triglycerides, high blood pressure, and type 2 diabetes. These factors increase the risk of developing cardiovascular diseases. Weight loss through a balanced diet and exercise can significantly improve these parameters and reduce cardiovascular risk. Increase in heart attacks. Among young people, between 2010 and 2019, there was a 59% increase in hospitalizations for heart attacks in people up to 39 years old and nearly 10% in deaths. Risk factors such as hypertension, diabetes, high cholesterol, obesity, stress, smoking, and sedentary lifestyle are increasingly common among young people due to dangerous lifestyle habits. The treatment usually involves oxygen therapy, increases the amount of oxygen to the heart muscle, aspirin, antiplatelet therapy, nitroglycerin and morphine. Relax the coronary arteries and relieve pain. Beta blockers reduce heart rate and oxygen consumption. Thrombolytic therapy dissolves blood clots. Coronary angioplasty. A catheter with a balloon is used to open the blocked artery, and a stent may be inserted to keep it open. Reducing risk factors is crucial. Half of heart attacks can be prevented with lifestyle changes. Quit smoking reduces the risk by 30%. Control blood pressure, ideally 120/80 mmHg. Control diabetes. Keep blood sugar under control. Healthy diet, low in sugar, soft drinks and salt. Plenty of fruits and vegetables. Less red meat and fried foods. Reduce cholesterol and triglycerides. Physical exercise. Be physically active. Lose weight. if overweight. Sleep well, 7 to 9 hours per night. Friendships, loneliness and social isolation increase the risk of a heart attack. Cardiological checkup, especially for those with a family history of heart disease. Sure, here is the translation, emergency action plan. If you or someone in your family is at high risk of having a heart attack, have an action plan. List of medications, including allergies. Doctor's contact. Contact information. Baseline electrocardiogram. Take a photo and keep it on your phone. Nearby hospital. Check if it has a cardiologist and emergency hemodynamics. This knowledge and preparation can make a vital difference in responding to a heart attack. Stay alert to the signs, adopt a healthy lifestyle, and share this information to save lives.